Hi Nigor. Welcome to the Pharmex Asia. Can you tell me something about the stand, the booth that you're having here at Pharmex?
A very good morning to everybody. So we're actually at this stall which is called the WHO stall. We are representing, however, the Stop TB partnership, as you could see for the logo. The Stop TB partnership is hosted by the WHO, and we are particularly representing at this booth the Global Drug Facility. The Global Drug Facility is an procurement arm of the Stop TB partnership. Our fight is against tuberculosis. We have been established to help countries to access quality assured drugs so that the treatment for tuberculosis is available globally. We have been established in 2001, and up to now we have managed to offer services to over 100 countries globally. So what do? We actually not only provide drugs to countries, we also supply the technical assistance to countries alongside of drugs. That would mean that countries that in the past have not capacity to procure the drugs themselves are being enabled and facilitated in terms of putting in place their systems and helping the programs themselves to manage in the nearest future their own procurement of the quality assured drugs.
Could you maybe elaborate on the tuberculosis itself, what it is, and why it is so necessary to tackle this problem still?
It is a huge burden globally today, tuberculosis. Some time ago, globally, we have thought that tuberculosis is no longer a disease that we should worry about. As of today, we do know that it is still a huge burden globally. As we could see from the facts of the 2012, on an annual basis, around 9 million people fell ill with tuberculosis, of which over 1 million die on an annual basis. So this is, in terms of numbers, it might not speak so much to many people, but those who have been affected by it do know that it is a huge burden. So how do we get tuberculosis? We get the bacteria once we are born, and during our lifetime, most of us do carry this bacteria in a non-active form. However, when our immune system starts being compromised or becomes weak a little bit, the disease might present itself. Therefore, it is important that all of us do understand that there are key symptoms which might indicate that the tuberculosis is present and that it has to be diagnosed. The crucial point is that we have to try to diagnose it as soon as possible and to treat it. Of course, diagnosis as of today becomes more and more rapid as opposed to decades ago. Now we could actually even detect it within the 48 hours. And that the treatment can be made available. Our main concern at this stage is that the 3 million that we have not been able to reach up to date, who have no access to the quality care. And most of those people are actually dying, and therefore we're missing them. In order to reach those 3 million people, we as a community could actually do a lot. These are the people who might have no access to the health care, and therefore we cannot reach them. These could be the people who are very sick and do not think that presenting to the health services would actually do them any good. And this could be the people that do not really think that they have tuberculosis, but they are the one who is actually spreading the disease. And it is therefore crucial that we reach those people. We bring them to the services, we make sure that they are diagnosed, and we treat the diseases as soon as we find and we confirm the diagnosis.
One last question before we stop. The countries that you cannot reach yet, are that mostly underdeveloped countries or are that mostly developed countries?
Unfortunately, the question about whom we are not reaching is not about the status of the development, it's about this of these countries. It is about pockets globally in both developed and developing countries that for whatever reasons we are at this stage unable to reach. So we could reach them together, and we could find those patients, we could bring them in, or we could take the services to them and make sure that we treat the tuberculosis.
I'm here with Casper from the WHO. We're talking about tuberculosis, how important it is, and what the WHO does to tackle this. Can you tell me more about the Global Drug Facility, please?
So the Global Drug Facility is a procurement arm of Stop TB Partnership. Currently we are housed within the WHO. From the next year we'll be moving to another UN entity to provide even better service to our customers. We have been established in 2001. And first we tackled the issue of the drug-sensitive tuberculosis, because at that time it was the major problem. As of 2007-2008, we also started to deal with drug-resistant tuberculosis, which is basically much more complicated disease to treat, and therefore even the situation with this type of disease is even more complex.
Logistics-wise, how is that actually going?
Yes, actually we have been doing pretty well, and we have been supplying more than 100 countries. Actually today, if you look at the total number of countries during the more than 10 years of our existence, we have been supplying to 134 countries. So basically, since that time, we have been supplying around 23 million of patient treatments worldwide for the first-line drugs, so which means that's the treatment for drug-sensitive tuberculosis. Also, we have been supplying more than 1 million patient treatments for the pediatric tuberculosis, and around 200,000 patient treatments for the drug-resistant tuberculosis. So this is, I think, major success what we have been doing. And on top of that, we are able to consolidate the deliveries because some of the orders are very small. This means that with the using of our stockpile, we not only can deliver very quickly, but also very efficiently, and we can decrease the price for the medicines.
One last question before we finish. How is it actually for the people that are now watching? What are you currently doing? What is the current aim of what we're trying to achieve now, and what is happening now where we sit here?
Yes. So our aim is to deliver around 25 million patient treatments by 2015. We are almost already reached the goal, and this is in conjunction with the global plan to stop tuberculosis. So this is where we're moving. We are also doing much more larger efforts at the moment to have more suppliers for specifically drug-resistant tuberculosis treatments, so that more patients are getting the access. And as well, we are trying to provide the countries with a new diagnostic, molecular diagnostic equipment, so they can diagnose the disease much more quicker, and also will provide better support in terms of drug management trainings for the countries.
Well, thank you very much for watching.
What a game! To beat tuberculosis, we need support from all people and governments. The world is in danger, and we must win this fight.